pain in the abdomen, burping gas, pain after eating, abdominal fullness. We have ulcerative colitis and IBD.
Irritable bowel disease, that's what I call it.
Okay, but you're actually, as opposed to irritable bowel syndrome, what's the difference between the two?
Are you asking me?
I'm asking anybody who can give me an answer.
Is UC and
Sorry?
Crohn's. Irritable bowel disease is ulcerative colitis and Crohn's. IBS is like the non-specific.
Oh, okay, so she's actually, so she actually has, an autoimmune disorder, basically. She has Raynaud's, which is possibly an autoimmune. Okay. And you have scoliosis, but I'm sure they're not saying that's why you have it. But you're saying, by the way, you also have scoliosis, and by the way, you also have, when they say gastritis, they mean upper GI?
The lining of my stomach was described as having gastritis. So it's a chronic kind of irritation of the lining of my stomach. And I've had that for years.
When you were born through a C-section because the cord was wrapped around, and the cord was wrapped around your neck.
That's why. And I was born in Saudi also.
That's not a medical condition in my
No,
opinion.
but my parents did not. My mom was like fearful that I had contracted something. She was like very fearful because I had cyclical fevers as a baby.
Okay, I see.
Until I was
0 to
about
2
3.
years old.
Yeah.
And what does that say, 3 to 4 years?
They took me to a psychologist because I was defecating at night,
Oh.
and they couldn't figure that out, and the doctor told them to rub my nose in there.
Oh my God.
I'm not even kidding you. Yeah. So I still kind of remember that.
And they did?
They did it like a couple of times, and then I remember my mom crying at my dad, and as he was doing it, yeah.
And then age 5 to 10, chronic sore throats and acid reflux.
Yeah.
In age 10, the tonsils were removed. Yeah, too much. She had too much pieces up her nose. They had to remove the tonsils. What kind of, was this
I was living in Texas. No?
Same thing, South Arabia, Texas. All these
Exactly.
Oh my God.
Yeah.
Right, age 14, right knee surgery for ballet injury. 14, fell downstairs, lost vision after a few hours. 14 to 50, gastro symptoms began.
Like the bloating, the ulcerative colitis symptoms is when that really began.
What time, when did your period start? What age?
I was 15.
So just before your period, and you were anorexic.
They told me that because but I didn't want to eat. It hurt to eat.
Okay.
And I didn't have any body.
And you had petite mouth seizures at age 15, diagnosed with that.
Diagnosed.
Age 18, car accident because of seizure.
Yeah.
19, diagnosed with Crohn's, similar symptoms to now. Age 21, kidney infection. Then interstitial bladder.
So I had ulcers in my bladder.
Age 24, went to chronic pain treatment center for joint pain and fatigue that became debilitating. Okay. Do you still have those?
I still have chronic pain.
Where?
Mostly my back, and then also my knees, my hips, my neck. Like, it's all involving my back.
You're going to ask me what I'm thinking, I'll tell you. I'm sorry. No, first thing I'm thinking, no. So, so did you see where things go? I could be totally wrong. Born in Saudi Arabia, raised in Texas. Too much fucking petrol in the system.
Yeah.
No, I mean, seriously, I'm not kidding. That I think there could be environmental stuff here. I think that's one of the things I'm going to keep as a possibility to look at.
Actually, in Beaumont, where I grew up, I know that a lot of the parents know that of my childhood friends have had cancer. And they call it actually Cancer Alley, like where I lived. So, yeah.
So by the way, that's another really useful lesson to watch. I used to think, when I first started, don't explain, because we're not encouraged to explain to patients and tell them how we think. You're supposed to be like some sort of magician. The opposite. Talk to them and extract more stuff. This would not have come up if we, in all likelihood, if we hadn't kind of felt, if you've prod them. So one of the things that, and by the way, Kiiko does that also, ask people, why do you think you have this? You'll be shocked at how accurate they can be. Sometimes they'll express it in ways that don't mean anything. It's like, yeah, sure. But then if you translate a little bit, you'll get a good end. You'll get something that's probably worth knowing. So I think being willing to be vulnerable in front of patients, you know, with a don't know mind and giving them power is useful. Okay. Age 27 to 28, constipation, severe.
I had to have colonics just to go to the bathroom. I couldn't do it on my own.
Okay, pelvic floor spasms treated with rectal
Botox.
Botox. Oh,
Yeah.
physical. Okay.
For like
Which
a
should be
year.
an interesting possibility here. Also interstitial cystitis again. Delayed gastric emptying this time. I'm sorry.
And a hiatal hernia.
And hydro. Okay.
Yeah. And at that time also my ANA was really high and the scleroderma tested positive. But I do not have scleroderma, so.
Age 30, gallbladder was removed, adhesions removed in abdomen. Some endometriosis. Well, I'm an endometriosis expert after all. I just told you. Impinged nerve from surgery. Which nerve was it?
Here. I don't know what nerve it is. I just saw a doctor
Do you still
literally
have
yesterday.
problems?
Yes, she wants to treat me next time I see her with an injection.
Okay,
It's right here.
what is the problem? Numbness or
No,
cramping? Or?
constant pain. Like even when I wear pants, like it's like when anything that touches this area, like Christian knows that it's really a very sensitive area with a lot of reflexes for me. I want to punch him.
Mother was bipolar with arthritis and rectal cancer, papa high blood pressure, depression, aortic aneurysm, prostate, psoriasis, chronic sinus infection. Okay, so at least one other autoimmune disease. Arthritis, what kind of arthritis does she have, or does she have?
I'm not sure. I think it's probably ortho, I'm not sure that it's autoimmune related.
Okay, that's
But she's also Dutch, and so there's a lot of cold weather, and she blames it on that.
Okay, lots of medication, so we'll let go.
That's what I haven't quite started it, but this was just prescribed to me. So it's a big list.
Prednisone was just good.
Was just prescribed. I
Just
have not
prescribed.
started that, but I have taken it in the past as well.
Okay, so let's try and summarize. So you have this terrible pain here. Any other pains, joint pains?
Yeah, my lower back,
Lower back?
my hips. I get like this kind of tingly feeling, like I don't know, like prickly. But I always have like a pain here, like a burning here.
Burning.
Yeah.
Okay.
And then also like around my rib cage. So.
Is it all just on the right side of the rib cage or both sides?
Mostly the right, associated with this area. This area is a problem spot for me, and also my feet, which I don't think is
What happens
related. I
when
don't
you
know. When I eat, I get like this really bad fullness, and then this area like hurts. It feels like I'm almost like aware that it's working. I don't know how else to describe it.
Okay. So when you eat, you get burping, gas,
Yes. And my whole abdomen will just like distend.
and bloody stools, blood and pus and stools.
All right.
No rubbing in anything. If I will give them herbs, which is pretty rare. Now, there are people who think I'm a really good herbalist, and I have no clue why. I'm serious. I'm telling you the truth. A lot of people who've taken classes with me around the world come to me with their medical problems afterwards, and they want herbs. So I prescribe them herbs. What am I going to say? I'll go somewhere else. It's like, so they, oh wow, your herbs, do such a good job. I'm like, I have no clue idea. I tell you, you want to know how I prescribe herbs? Just like acupuncture, by name. I use the name of the herb much more interesting than, I remember the general thing. So the tongue is important because hot, cold, stuff like that for herbs, but otherwise it's not a big deal for me. So I'm really looking more at the symptoms and woo theory kind of thing. But I'll do, like recently I did, so.
I don't know. I'm fine. I feel
I
weird
won't
just
prescribe-
laying here, sorry.
I won't prescribe you any herbs, don't worry.
So, Avi, do you create your own formulas with powder or raw, or?
I write it out for people. You go to Chinatown, get you what you want. Here it's easy. And by the way, if you have problems with that, it's very easy because all you have to do is download a list, because it used to be very hard. And I used to try and write. And then the herb shops in Chinatown would refuse to fill up the prescription because they told the patient that you have a 5-year-old, you know. You know. But now I just print it. You know, because everybody has a computer nowadays, so you can just take, you know, Chinese characters, print them out, and it doesn't matter. So they don't know that I can't write Chinese. All right. So I'm going to check out the next one. Are you okay?
Yeah,
Are you,
I'm okay.
I'm not touching this area
Okay.
yet.
Okay.
I'll
Thank you.
have to at some point, granted. What is this one from?
That's the all from the gallbladder. It didn't heal, and so the
No.
physician actually, I had to go back, and I didn't have health insurance, so he just sewed me up on the table there, and it was still like an open wound. And that was in New Jersey. It wasn't in Texas, so.
That's a bit of a, excuse me, I know you're from. That's a bit of a problem there too, isn't it?
It is, yes.
All right. So one of the things is because it's right side ribs. I mean, I know she had this operation. Now, what was the operation for again?
It was originally just to go in and for the endometriosis, but they said that they would check the
And
gallbladder.
that's
Because I had symptoms, but the ultrasounds looked fine, all the testing was fine, and then when they got in there, they said it looked necrotic. So I was like, oh, okay.
Now, endometriosis is a liver issue. Cysts also, by the way, is a liver issue.
Which I just found out I have as well, so, sorry. Yeah, my liver must be super happy.
You have ovarian cysts?
Yes.
Okay. Do you have, in the uterus, do you have any fibroids?
No.
No. Okay. Do you have cysts anywhere else that you know of?
No. I don't.
So in my opinion, she's going to fall down to liver. But I don't know yet. So, okay.
Not kidney associations
With cysts?
and uterine issues?
No, it's something that, no. It's, for me, it's liver. Definitely. Best point for cysts is liver 8. Best point for endo is liver 5. Okay, so, no, I don't see a kidney connection at all with cysts for me. No. Even though the ovary itself is in the kidney domain. The uterus, to me, is in the liver and the spleen domain. So, I'm not sure how this is going to work out with the palpation because you have, you know.
Yeah.
So, of course, she has ulcerative colitis, so this
Yeah.
is normal, this is not comfortable. Okay,
And
so.
I mean, like, nothing here
Nothing
is
is
comfortable,
com-
yeah,
oh, that's-
but I'll be okay.
Okay, so, hi, anything here?
It moves over
Moves
here.
over. Okay,
yeah.
just remember, how about here?
Not so much.
Not so much, okay. How about here? Yes.
That's right, yeah.
Okay, so adrenal, especially on the right. How about here?
Yeah.
Okay. All right. How about,
I don't like this.
okay, hold on 1 second. Okay. I can't, there's something very vulnerable there. I can't quite feel the pulse. I'm looking to see if I can feel the pulse and I can't, I'm too afraid to push. So, it's okay. Sorry.
Sorry.
Are you okay?
Yeah.
Let
I'm
me
fine.
know.
Okay.
Hi, here.
It's just like it feels like it keeps moving over to this one area.
How about here?
That's okay.
Here.
That's okay.
Okay, and we know about this one, we're not touching yet.
Okay.
Let's do the gynecological stuff because of the endometriosis and cyst. Okay. Kidney 13 is uterus reflex, okay? So, uterus?
Yes.
Okay. How about ovary?
That doesn't hurt as bad.
Okay. Uterus, this side. Okay. Ovary, this side. Okay, so really, uterus, right side. Okay. And this stomach 27?
Yeah.
And this kidney?
Not so much.
Oh, before you had?
Yeah, I don't know why.
Okay, so this is no big deal right now, but this is.
Yeah,
Okay.
that's more sensitive.
Before we come, are you okay? Are you
Yeah,
nauseous?
this a little like this spot just it still feels like you're pressing. I don't know how else to explain it.
Just from me putting my hand over,
No,
it makes
it's
it feel
just-
like.
I don't know,
Oh,
from you
I know,
pressing
yeah,
everywhere,
okay,
I still
got you.
feel it.
Okay, got you. Oh, I'm sorry.
That's okay.
1, 2, 3. 2 very clearly.
Yeah.
1, 2, 3.
Two.
2. Stomach 9. Okay.
Sorry.
No, it's okay. Stomach 9 is very important. First of all, one of the things that I have a few routes to go. One is, the liver, blah, 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 toxicity, whatever. Then I have another route, which is I'm suspecting that, remember her symptoms started age 14? She got her period age 15. Number one, for your age group, 15 is late. right?
Yeah, I was like one of the last girls.
Yeah. So, so I'm thinking maybe possibly something to do with hormonal system, possibly. Okay, that yes, autoimmune. Autoimmune treatment is systemic metal water treatment. What does that mean? On her, we cannot do REN4 because her symptom is down here. I can't use REN4, but other people with autoimmune disorders, we do REN4. Okay, then, which is fire of fire. It's the moo point of the small intestine. Then we do kidney points plus lung points. Okay, which ones we have to decide, but that's our general direction in autoimmune. If they have slow pulse, I definitely don't do REN4. I don't needle abdomen in slow pulse. Nagano said, hold on one second. Nagano said don't needle the lower abdomen in slow pulse, don't needle the spine in rapid pulse. That second part, in my opinion, you can remember it, but you can ignore it for the most part. Okay, I've also seen it change all the time, with this rapid pulse in the spine. But slow pulse, if you think about it this way, when somebody has rapid pulse, they're excited, and they breathe in their abdomen, it slows the pulse down, okay? If you stimulate the lower abdomen for slow pulse, you might slow the pulse further, and that's not a good thing, okay? So, yes?
Do you do the lung fire point to check for that when you're doing the lung?
You could, yeah, in order to check which, You can always check fire points to know which points to use in a meridian. Absolutely. The two places where it's kind of compulsory, so to speak, will be kidney and pericardium. The rest you can have other ideas. But in kidney and pericardium, it becomes pretty major. Okay? Because, for example, in her, if she has liver 2 pain, but I decide that liver 5 is the most important point for her, it's going to take precedence. Okay, whereas in kidney, it's not going to be so easy for me to say something like that.
Okay.
But in liver, I'm willing to say, okay, yeah, you have fibroid. Plus, by the way, in the lung,
is really sore at precedence.
what pericardium 8 is going to dictate to me what I do in the pericardium.
Okay.
Absolutely. Now, with lung, I basically, from my perspective, I have 3 points on the lung meridian. 4. I have lung 4. For people to make them be able to breathe more. I have lung 5, which is the main one that I have. I have lung 8, and I have lung 10.
Right.
I don't have a lot of options. So 2 of them are the metal water anyway. So no big deal. Lung 10 I use for maybe UB23 pain. You can use lung 10. There's a correlation. It's originally lung 10 is considered. Now our lung 10 is more to the side. It's not on the bone. It's more like right behind large intestine 4. It's originally called producing sperm point or something like that. It's for male.
Honeymoon point.
I don't know about the honeymoon, but honey, can I have a little moon? So it's I don't know. It's no, because they use it for older men, not in their honeymoon. they are the ones who have the problem. Okay, so in Japan, that's considered a men's point for increasing stamina or whatever. So, but it's also used for kidney muscle pain. Kidney muscle meaning quadratus lumborum. Okay, so let's pick some. So now, stomach 9 can be a number of reflexes. Number 1, it's thyroid. If she lived in a toxic environment, not just the liver is affected, the thyroid is affected also. Okay. It's a possibility. I'm not saying it is. The other thing that stomach 9 reflects is stomach 9 reflects what we call primitive reflex, or primitive. Like eating is primitive. She had
They said anorexia. Yeah, I didn't want to eat.
Yeah, that's a primitive reflex, or bulimia is a primitive reflex situation. That shows on people who've had that. So something, so I'm going to look at, first at stomach 9. Usually if stomach 9 changes, abdomen changes. Because to poke right now, her abdomen kind of is not going to be a good idea. Okay, right?
Yes, thank you.
So again, to show you that the most important thing is not the abdomen.
Avi, you mentioned hormones first, and then you jump to autoimmune. Are you equating those two?
No, I'm not equating them at all. They're two separate things. They can be correlated, but no, there's no escape from the fact that she has an autoimmune disease. She has it. It's diagnosed. It's not me thinking. Me thinking now is what else the fact that she's going to get kidney and lung no matter what. She cannot have Ren 4, she'll have Mushu. Okay? Before I do that, because I'm almost willing to guarantee, okay? In fact, I'll show you. This was a disgusting one, right? I'm sorry, it's his fault, not me.
Okay.
It's always
Yeah, that
Sorry
hurts.
about this. Sorry
Okay,
about this.
that's
It
okay.
hurts. Okay, I remember. Hi, relax.
Okay, sorry.
It's okay, it's okay. How's this guy now?
It's not painful. It's like, it doesn't feel comfortable.
Yeah, but it's not like it was before. Okay, fine. Okay. Mushu is going. Mushu first. Originally, Mushu was a substitute for Rent 4 to begin with. Okay. Mushu does a great job for autoimmune. Also, don't forget, everything here is congested. Mushu is about giving him space, extending them. Okay, trust me, I use Mushu. If you ask me 2 points that I use, what do I use the most? Mushu, number 1. On the back, do 2, T11, 12, and T5. If you ask me, like, if I want a protocol, I want to call it the Avi protocol, sort of thing. No diagnosis, no nothing. Do this on everyone. Mushu plus do 2, T11, T12, T5. You know, you kind of have. The thing is, Mushu comes in combinations with other things. You can add more things to it. So that's where it can get, like you can expand the protocol.
Mushu's for upright, creating the upright of this.
Yes, it's to create space for the organs to exist. It's to create, are you okay?
Yeah.
Now, of course, you know that she has autonomic nervous system disorder.
Yeah.
No,
I'm anxious. Yeah.
Of course.
Super
Listen,
anxious.
if you're sick your whole time, you're going to be anxious.
Yeah.
It's okay. It's not a judgment. Okay.
Okay.
So let me check on. Okay. So you had here, right?
The 2, yeah.
Am I on it? I need to go
Goes
somewhere.
over. Yeah.
This one.
Right.
You don't mind this one so much. I'm like, okay, fine. Hi, how's this now?
Okay.
Gone?
It's not gone. It feels tight still,
Okay,
but
hold on. Now,
that's easier when you press.
okay, how much is gone? How much is left?
Only a little.
Okay, fine.
It still feels tight.
We call this stomach chi. Okay, still.
Okay, I just, I know what you're doing.
Oh, I'm checking stomach 9. If I can fix stomach 9, hopefully I can fix the abdomen, because it's hard to poke on her abdomen. So she's actually a good case because she shows you a place where you're not going to be able to do everything by the protocols in the abdomen, because the person's going to scream and they're going to leave before you finished. Okay, so I want to check another option. I want to check my estrogenic option. Oh, I'm sorry.
Okay.
Okay, don't ignore the foot. How is stomach 9?
It's easier. Like,
And it's happier than the previous one, right?
Yeah.
Okay, good. Can I have,
yeah.
can someone press this one also? Just with your nail, press into maybe 66.
66, maybe 66.
Maybe 66, just press straight in.
That's the estrogenic?
That's hormonal estrogen point. Okay.
Yeah,
So,
got it.
Yeah.
don't do too much, if you don't want. Hi, this is okay?
Yeah.
How about this?
That's okay.
Okay. How about this one?
It's okay.
It's okay. Okay.
It's not that bad. Yeah.
No. I'm just checking. How is uterus?
No, it's not like before.
Okay. Ren 12?
It's still sensitive.
Still, okay, fine. Now, excuse me. How is, I'm not touching yet. How is this area feeling in the liver?
It's interesting. I felt like you were still pressing this whole time, and now I don't feel that right now.
So UB66 is going to be a really important point for her. Okay? So, okay, let go. Because, now, now, just because we found UB66 does not mean I start there. Why? Because if UB66 is going to fix everything, then I have nowhere else to go. I don't have anything else to check. Okay? So, in my mind, UB66, fine. Now, next, I know I need to do kidney, yeah.
And you came up with that based on the fact that her period started late?
No, not exactly. Combination. Mostly, her symptoms start at age 14, 15, and because I know it's puberty. By the way, just translate to Suen chapter 1. 14 is 7 times 2. Don't you know how to translate to Suen chapter 1? Come on. Don't you have Google Translate? So, every 7 years, blah, blah, happens, right? You know, so age 14. So then I'm curious if it has to do with puberty. So then I'm just asking, when did her period start? And she said right afterwards. So first symptoms started, then menses started. So I'm thinking maybe related. Now, why did the menses start late? Chances are because something stuck in the liver. I don't know, but I'm not sure if today I'll have an opportunity to really investigate this poor liver, because I don't want her screaming. So I'm going to, stomach 9 is called Zhen Yin, meaning Ren meaning person, and Yin means to welcome, like it's like a seal, it's like facing each other, so to welcome yourself. Okay? In puberty, it doesn't say, it's not Zhe Yin, Zhe meaning child. Okay? It's not that, it's Ren meaning it's an adult already. So welcome into adulthood. Okay, stomach 9 is basically the name. It's an interpretation of the name, granted. It's not exactly what the name says. So stomach 9 she has problems in. Okay, so I'm hoping that if I fix stomach 9, I will fix everything else. So I'll start, let me deal with that. Now, next. So I need to check which kid, I know she has to have kidney and lung and mushu. Okay, now, by the way, everything I start on the left side, always. We start left side, we call the chi side. You do not, I know. And right side, we call the blood side. You move the chi before you move the blood. You think exactly the opposite, okay? The left side you think is yin and blood, and the right side you think is qi and yang. The reason why we think opposite is this. First of all, okay, if I told you the liver is on the right side, and the liver contains blood, you would say, but the liver is commanding the chi. So either we lose one, no matter how we deal with it with that. Okay, so that's not relevant. If you look at the intestines go up, across, and down. Okay, what goes up is on the right side in the body. You know, that's the one place where we see it. Goes up on the right side, goes down on the left side. Okay, what goes up?
The earth comes up to heaven. Yin goes up. That's what I meant.
Yeah, so this is going to be a little counterintuitive. Yeah, the yin goes up because it came from earth.
Oh my God.
Okay, I understand that yang by quality moves up, but yang, look at the meridians. The yang meridians come down.
Oh yeah.
The yin meridians go up. You have to take the same modality of thinking.
Yeah.
Okay, you know, because so the yang meridians, they started from heaven. They're not moving towards heaven. They're moving towards earth, granted. But in the yin meridians, they came. So the yin moves up. The yang actually moves down. It came from yang. It can't go further up to extra yang. Okay? So therefore for us, the chi side is the left side. We move the chi first, then we move the blood. However, with mushu, strangely enough, first I started doing it because it's not convenient for me to do this. You see, I'm twisted. Okay? So I check always right side first. And strangely enough, right side mushu is stronger. Okay, so you talk about Kabbalistic whatever. Netzach and Hod. Does that make sense to you?
A little bit.
Okay. You have to be victorious before you can glorify. Is, you know, so I you know, obviously Chinese didn't think like that. So yeah, I don't know where this comes from, but you know, just so that you know that mushu will be one of the exceptions where I will do right side first. Okay. Now the low back. Can I touch the low back?
Sure.
Will that be okay?
Yeah, that's fine.
Because I want to make sure the symptoms get better also. So here.
Yeah.
So number 1, UB66. How's the back?
No, it still hurts.
Still hurts. It's okay.
It's like it's yeah.
Okay. Do you have kidney 2 pain here?
Yeah, like that inside, like we do
Okay.
a lot.
You
Yeah.
hated that. Okay. So kidney 7 and 10. How is the back now with kidney 7?
That's easier.
How
It
much
doesn't
easier?
hurt. Oh, like half.
Half.
Easy, yeah.
Okay. Can you press kidney 7 upwards? Not too much pressure because she's sensitive. And
Okay.
kidney 10. And now,
That's better.
How much
It
is the
hurts
leg?
on my leg.
Forget the leg.
Nothing.
Nothing.
Like
Okay,
that feels
fine.
okay.
So
Yeah.
kidney 710, because she has kidney 2 pain, it got dictated. Okay? Fire point pain, I have to do metal water. I do kidney because she's autoimmune. Fair? Okay. We'll check which lung point. So you can see here's a case where I don't have abdominal protocols. You know, it totally comes from the medical history. Hi. How's the back now?
That's still sore.
Okay. Now,
It's easier.
how much?
I mean,
Lots.
that's better, yeah.
Okay, good. Okay. Next, wait, we're not done.
Okay.
So
I'll get this out of the way.
I have to get my, is it endometriosis or is it cyst decision on my liver? Okay. Hi, here, right?
Mm-hmm.
Yeah, liver 5. You like it?
Yeah, it's okay.
Compare.
That one's actually better.
That is better. Okay, fine. So now I'm really sorry. I'm just, not a lot, just a teeny bit. Tell me if it's too much.
Sorry.
That was fear, wasn't it?
It's a little.
It's a little, okay, it's a little, okay.
It's a little.
It's a little
It's
already
a
with this.
reflex.
Okay, fine. Oh wait, it's a reflex or it's a little
I don't know.
painful?
It's both. Like
Okay, fine. How is reflex now?
it still hurts.
Still hurts,
Yeah.
okay. Compare for me.
That hurt.
I can say,
Sorry,
okay, no,
yeah.
it's okay. Any pain on this kidney?
That foot.
No.
I'm sorry.
No,
Okay.
it's no pain down here, right?
No.
Okay. So I'm looking for toxicity option. Kidney 9 is my toxicity option. Hi, how's now?
That's better.
By how much?
You're doing it. It's not bothering me that much.
Okay.
So that's
Would
good.
you relax this shoulder?
Mm-hmm.
Friend of kidney 9 for toxicity is large intestine 15. Hi now. No, didn't do. Okay.
Sorry.
It's okay, it's okay, it's okay.
Okay.
So, here, right?
Mm-hmm.
How's now?
That's good.
That's the best?
Yeah, that's the best one.
Okay. Number 1, hormonal. Number 2, good friend of Mushu. Mushu and UB2 are great friends. Why? Because one of her problems is coordinating the 3 dantians. This represents the upper dantian for us. Okay, so lower dantian and upper dantian, if I can coordinate it, everything in the middle, we'll start. Okay, so let's get started. Are you okay?
Mm-hmm.
Avi, earlier when you were doing UP 66, you said we can't stop here even if it corrected everything. Why
Yeah,
not?
well, no, I won't start with it. I won't stop here. Because if I did, say UB66 fixed everything, then she's left with 2 needles, and I have no insurance. I basically put all my cards on UB66, and I have absolutely no insurance whatsoever for finding other points. How do I know which? I have to do kidney points. I have to do long. Yeah? Does that make sense? So I don't, just because I found it, I'm not going to start with that. I'm going to start with everything. I'm going to still find out everything else. Okay? So, and actually I won't even start with that for another reason right now, which is, let's just go with the kidney first.
But once it comes to treatment, why not just do
You could.
UP 66s?
Oh.
Because I know you might not have insurance now, but that's what you got. And you're not going to know until the second visit.
But I have more points that I want to try.
For your,
I don't
for
want-
your benefit or for the patient?
Both.
Okay.
How do you know?
I don't know. That's what I'm
Okay,
asking.
because it's too much assurance to say UB66 fixes everything. It's a little arrogant. Do you know what I'm saying? It's arrogant on behalf of UB66, not on my behalf.
Okay.
I mean, it's too, like, why? Why just one point, you know, when there's so many others that you can still use? I mean, it's not like the end of the world to do a little bit more.
Because I thought you were trying to
prefer,
find the one dominant.
I want to find the one, but I also want to do more. I hear you. I'm totally contradicting the official statement. I want to find the one, not to make it the only one. I want to find the one so I have clarity. But it could be 3, because for her, no matter how good UB66 is, No matter how good UB66 is, she's still autoimmune. I cannot escape kidney and lung. Can't. No way. Impossible. It has to be. The autoimmune is one of those things, if you have it, I can do something else. I have to do it. Diabetes is one of the other ones. If you have diabetes, I've got to do spleen 3, adrenal, immune, and OD. You know, I'll show you those tomorrow.
What does she have? I'm sorry.
She has autoimmune ulcerative colitis and Crohn's. Oh, sorry, you came later. Yeah. Okay. So let's start kidney 7. You okay?
I'm okay.
You don't mind needles, right? You just mind poking.
I wouldn't have shown up, yeah.
I don't know.
Thank you.
Please
Yeah.
come to our abdominal diagnosis class.
Do you know the time at the TCM Kidney 10 location?
Yeah, I don't know for now. So there is no separate. Okay. And here we'll do kidney 9. Okay. Now I can do UB66. You okay?
Ooh, yeah.
Yeah, that's why I didn't want to do 66 first, because sometimes it's a little bit uncomfortable. It's too close to the bone.
And the kidney 9 released for stomach.
No, kidney 9 released her liver. I finally did get, so now, stomach 9's okay? This stomach 9 is okay?
Yeah.
Okay, good. So, sorry. How is this one now? You don't,
A little, like, it's
Okay.
weird when you press here, I feel something up here.
yeah,
So,
that's okay. It's as if it's there. Okay.
but
so-
you're touching it, which is a major accomplishment, to be honest,
Okay.
so
And you had here also, right?
that's good.
That's good, okay. I still need to add stomach G. Stomach G are points on the stomach channel where there's a bump. Okay, it's not a specific point, and we started them between stomach 40 and stomach 40 and 41, but they can be above it. Okay, so
Just slide along the area.
yeah, until you look. There's a mark of my fingernail.
see
You'll
it.
see there's a bump if you touch. There's a bump underneath.
Do you do above or below the nodules?
Above, because I'm needling it down.
Into it?
Yeah.
Yeah. I'm needling it down. Okay. So you said there's still some here, right? Okay, sorry. Now, gone.
Yeah, it's
Okay.
not bothering me.
So I cannot do stomach chi on the right side unless I do a stomach chi on the left side, because stomach chi specifically relates to chi, to the zang chi, to the chi of the chest. Okay. So and that chi does start on the left side. So I'm needling down and towards the bone. So slight angle towards the bone. And you're very, very close to the bone with this point.
For some people, you have to do,
Good.
Yeah.
All right. So, yeah, what was the question?
a lot of people have multiple nodules. Do you have to just do?
You can do
multiple?
more than one. You can totally do more than one. You can do 3 at the time. You can do 4, take one out, and put below.
Okay, but sometimes I've had people with a lot of nodules, a woman has multiple bypasses.
Okay, don't do 20 of them.
That's what my question was.
Yeah, no. So my answer was, you can do 3
3.
at a time. So you can do 4, take the top one away, and move it further down. So you can have
It's
3
like-
or 4 at a time, but not 20 at a
And how
time.
long might you leave the first 3 in before you move them?
Only move one. Only move the top one further down. So next treatment, so you have 20 nodules. That means X amount of treatments. By the time we finish 500 treatments, you will have no nodules. Please pay in advance. I mean, you can only treat so many nodules in one treatment. It's not. Plus, they will not. By the way, they don't disappear. No, I mean, I've never seen somebody with huge amount of stomach chi and totally gone.
Nor do
After
the
any
patients
amount of
like it.
treatment. Sorry?
Nor do the patient enjoy it.
Oh no, they probably won't. They probably won't. Yeah.
Sorry. Hi.
No, it's okay. You will go. Okay. So, okay now? Excuse me. How is this guy now?
Okay. I don't feel like it's moving
Okay.
over.
And here?
Yeah.
It's good.
I can't believe you're pressing it, honestly.
Well, I'm barely pressing.
Yeah, but usually that will cause a reaction.
All right, all right. We know, so this is why I check a lot of things in advance, because sometimes you can't check them afterwards. Okay, so I know this side was lung 8, because it was checked against her back, and the other side will check which one it's going to be.
You check lung 8 again.
Against her back. She had back pain there, because she says she has pain. Okay, where else do you have pain?
My neck also.
Okay, let's go. Relax. 1, 2, 3, 3. Okay. So, how is 3 now?
Still hurts.
Okay. Hi.
That's easier.
Okay. So just because one side is 1 doesn't mean the other. Now, there's nothing that correlates lung 5 to her neck. What correlates is her case is autoimmune, therefore I'm dictated to do lung. And I'm just checking whatever I can, because it's easier to check her neck than to check her, well, to check the abdomen. Plus, right now, there is not much to check in the abdomen, it appears.
So even though it's C3 was covered?
Which would have, yeah,
Didn't matter.
it was. No, because officially it's liver. And I mean, at some point I'm going to get, it's, you know, this is what, this kind of patient is the kind that it will be a peeling situation. You know, you peel one layer at a time. You can't get to the full story right now because I can't touch. You know, so at one point we'll discover what's, if and what is happening in her liver. It's okay, right now it's okay. It's acceptable, for me at least. Okay, so how are you okay?
Mm-hmm.
Are you feeling okay?
Yeah.
You sure?
I feel good, yeah.
Okay.
Thank you.
Any pain anywhere?
No?
Okay, this is good?
Yeah.
100% good?
Do you mean like right now, or do you just?
Yeah, right now.
Yeah. I feel like a burning, like
You feel a burn?
Yeah,
Okay, fine.
but it's not bothering me
Okay.
really. I'm used to pain, so it's
Okay.
really hard for me to kind of, yeah.
How's the burning?
It's good. It just burns where you're touching me. That's
It burns when where I'm touching
It really does. These points are very painful for me.
Could you press on for UB2? Let's see if I can fix it for you.
One side or both?
Both sides. Go
Is that okay?
slightly more lateral. Slightly more. Yes, yes. Okay, good. Press.
It's burning more on the left, but the right one, it's not burning. This one, like
Okay.
this still burns,
Hold on.
but
Okay, hold on. I'll replace you.
I'm gonna press on the right.
Yeah.
yeah.
Gone?
Yeah, that's crazy.
That is one of the reasons, what she just said, is one of the reasons why you definitely want to, you asked me, does the patient have to feel? That's why it's better that the patient feels. That increases the placebo effect, that trust, that, oh wow, you actually do this. So now, unfortunately, I'm doing the opposite. Instead of going Mushu to UB2, I'm doing, usually I'll do it the other way around. Okay, don't be afraid. I know it feels like, oh, needle in the eye. No problem, right?
And UB2, did you say that correlates to some sort of hormonal?
It correlates, number 1, to hormonal, but number 2, it correlates to the upper dantian. So the Chinese understood already this concept that the pituitary control, okay, there is, there's,
I did
she
forget.
has a cyst in your pituitary.
I do. I forgot about. I'm so sorry that I know it's too many things to remember.
Blame
I know.
We don't blame you, we blame the cyst in your pituitary.
Is that
Well, that's why you forget about it, because you
That
can't
was-
remember it anymore. No burning, right?
No. That was in 2009, 2010 also.
So, I was going to say something else, and I forgot what it was now. So, no, not you.
Chinese, the dantian,
Oh, the dantian, yeah. So there is, In the Ling Shu, the character Ming Men appears 4 times, but it actually only appears twice. Okay? Meaning, each time it appears twice. So, in each time it's something about the bladder channel, and it says, you know, that the channel goes to Ming Men. Ming Men is at the eye. That's literally okay, now you think Ming Men, we think L2, but it's in the eye, meaning UB1 is Ming Men for the Ling Shu author. Okay, now since I don't like needling UB1, okay, no, I mean some people like, you know, big needle, you know, like get it bruised, whatever. UB2 is better. Okay, so for Nagano talked about UB2 as being upper dantian point. So the Chinese already, but you know, it's like, okay, he says Ming Men is in the eye, but we all know that Ming Men is L2. You know, it doesn't matter if Ming Men doesn't appear anywhere else in the Ling Shu as L2, but we understand that L2 is Ming Men, meaning that they somehow understood that the pituitary and the gonads relate. So he's saying the fire, the Ming Men fire is here, but who's controlling that fire? Well, the damn pituitary apparently does. Okay? So, and then we'll just add liver 8. I don't want to poke too much, so I'm not going to check it against anything because we already knew that on one side. It's okay. Oh, sorry.
Do you ever use the yin tang for pituitary issues?
No, because it's not in my, just because it's not in my vocabulary, not because it's wrong. You probably could. And by the way, I use UB2. Kiiko likes to talk about UB2 and Yu Yao together. Yu Yao for me is a supporting point for that. Okay, so not so important for me. Okay, but no, it's clearly UB2, not Yin Tang for me. You know, you can make an argument the Yin Tang is in the center, blah 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 blah, but you know, there's just something that doesn't quite operate for me. Remember, I like the sides. So, and immune, because she is autoimmune, we add immune points. So protocol for autoimmune is REN 4. If it's slow pulse, it's going to be UB27, that's the equivalent. Plus kidney, plus lung. If it's slow pulse, what it means is on the front you can do kidney and lung, you cannot do REN 4. Ulcerative colitis, Crohn's, you cannot do REN 4, too close to the problem. Then, on the back, for slow pulse, you do UB27, plus what's the equivalent of kidney? UB23 or 20 or 52. What's the equivalent of lung? UB13 or 42. Okay, relax the arm totally. Thank you.
Avi, when you say kidney, you're saying you have a few points on the kidney channel you can select from and
yes.
test for?
So on this side you have
generalizing as you
yeah, kidney, something on the kidney.
Or one of the lung points you usually use.
And same thing with lung. You see, she has lung 8 on this side, she has lung 5 on this side.
Okay.
So which one was most effective? With a kidney, this kidney 2 was painful. By the way, how is it now?
It's fine.
Okay, kidney 2 was painful. I had to choose kidney 7 and 10. It's one of my laws. Okay. This side, kidney 2 was not a problem. By the way, do you see her stomach 41 is way too extended? She's going to walk around with a press tuck afterwards. Believe me, she'll have a press tuck on stomach 41 because that's not a good stomach 41.
Extended meaning.
She's overpointed.
Dorsal flexion.
Yeah, I mean, it's great.
So what'll happen to her?
She'll get a press tuck on stomach 41. That's what will happen to her.
She thought it was an addition.
Yeah. Yes, in 5 years she will have. Okay, here, right? Okay. How's now? Better? I want gone.
Okay, okay. That's better. That's, yeah.
Okay, good enough. Let's do the other side. Immune point, yes. Because autoimmune gets small intestine more shu, fire of fire. Okay. Plus, autoimmune diseases start, the most lymph nodes you have are around the small intestine. All your immune system is in the small intestine. If you want to go with a modern understanding of it, is all autoimmune disease starts because small intestine allows foreign objects into the lymphatic system, right? That's a very common, functional medicine way of looking at things, right? So small intestine more shu plus kidney plus lung. If it's slow pulse, your emphasis is on the back, to do the same thing on the back. If it's regular or rapid pulse, you do front. Now, I always treat both sides, by the way. One, two, three. Ooh, three. Okay. Two also, I know. Hi, how's three?
Okay,
And how's two?
good.
Okay, good.
And you're feeling like back, posterior of the SCM? Like just kind of-
Sandra 16 is behind the SCM. I press it towards the nose. So I'm pressing it into the SCM and slightly towards the center. So it's not SCM and out, it's SCM and in. Okay, so what time is it, just so that we... Someone has a clock?
It's 2:30.
Okay, so we have a few minutes to do Moxon.
2:32. 2:32.
Okay, it's okay. Can I just get... No, not your fault. So, she is definitely... Moxa is very important for her because it's long chronic issue. She may not like the Moxa, I don't know.
I don't mind it.
Well,
I don't know what you're doing with it, but
smart girl. All right. First of all, she has Raynaud's. Okay, so the extremities are not going to operate well. Secondly, I have a few points here that are just like begging for Moxa. Immune point is a very much a Moxa point. Stomach Chi is very much a Moxa point, especially since I only used one. And liver 8 is a Moxa point. So this is your time to ask questions because right now it's going to be very boring with a lot of smoke.
Okay, the angle of UB2 and Mushu, I wasn't able to tell what
The angle, UB2, whatever you can get in, you get in. And an ideal, so you can either needle it up or down towards UB1, doesn't really matter, in my opinion. Mushu is straight in, unfortunately, even though I said I don't do 90 degrees here.
How do you decide which points are Moxa points?
It's kind of dictated by historical things. So, immune point is just we know that it's a Moxa. Or anything to do with immune. Remember on the lymph nodes I wanted to do Moxa? Anything to do with immunity, I like Moxa. Some points are Moxibustionist's point. Now this is not a Moxibustionist point, this is a Nagano point, but so it's not like I can say it's a Sawada point. Sometimes you'll see a name like Sawada large intestine 2, which is this large intestine 2 as opposed to this one. Okay, then you know it's a Moxa point. So by tradition, certain things are Moxa. Liver 8 is a Moxa point for cysts. Liver 5 is definitely only Moxa for endometriosis. Large intestine 15, we use Moxa. Spleen 3, lung 8 would be Moxa points because, and UB66 will be a Moxa point because, even though I'm not doing right now because it's a lot, because this is the element on the element. Now, kidney 10 is element on element but is not a Moxa point. But generally, when you have the element on the element, it's a good chance that it will be Moxa. Stomach Chi, we do Moxa. Immune point, we do Moxa. We'll do lung 5 Moxa if we're doing it. Are you okay?
Mm-hmm.
We'll do lung 5 Moxa if we're doing it for bronchitis or cough. A lot of the shoe points we like to do Moxa. If you have feet points and cold feet, we do Moxa. Which kind of basically said I really should be doing UB66 Moxa. But we'll see how much time we have on this. Next question. Honestly, this is your best time for question.
Could you use the
Because I'm captive, right?
stick-on Moxas?
No. If you want to do stick on, stick on like ibuki,
The little cone, yeah.
you can try, I don't know. If you want to do the Moxa stick, however, you can with newspaper. You put the newspaper on and you touch the newspaper with a Moxa pole. If you bring me some newspaper and an actual Moxa thing tomorrow, I'll show you how to do that. It takes way more work than this, in my opinion, and it stinks like hell. So I actually don't recommend it, but... No, but it's more familiar to you, so it's easier. But this Moxa, do you feel hot or do you feel like mosquito bite?
When you're doing this?
Yeah.
More like, I feel burning, like it's burning me.
Okay.
Hot.
Okay. Often people will say, well, she's very sensitive also, she's got a little scared and stuff. But usually people will say something like, it feels like a little prick. It feels almost like a needle, and that's what moxa really should feel like, in my opinion.
What about no moxa? Do you have any results or understandings if you don't use moxa?
Yeah, I told you before, lots of people don't use moxa in this style at all. But moxa definitely makes it better. The results last longer. Now, there's no question, but moxa is you're better off doing moxa. You're better off, but the patient is better off if you do moxa. Some patients you can't do it on, for example. Their nervous system's so sensitive, they don't like the unpredictability of it. They just can't take that it comes and goes like that.
You mentioned small intestine.
Is the root. You didn't because I can't do leg 4. That's my issue instead.
Yeah, you mean the actual small intestine, not the small intestine channel.
Yeah, I'm talking about the actual small intestine as an organ. Yeah, the moot point of the small intestine. Fire, it's the yang fire element, right? If you think of autoimmune as systemic inflammation, you treat it as metal water and the yang fire. Make sense?
Yeah, metal water, whatever channels I think.
No, metal water, systemic metal water is kidney and lung. So your treatment for autoimmune is REN4 or UB27 if the pulse is slow, plus kidney points or UB23 or 52 if the pulse is slow, plus lung points or UB13 and 40 or 42 if it's slow pulse. Does that make sense?
Yeah.
I have a question.
Yes.
Before, not on her, but on Brian, you're checking the liver reflex.
Mm-hmm.
So pushing under the rib cage.
Yeah.
And then were you also pressing on the rib cage?
You press liver 14 as well as under the ribs.
Okay.
It's both. Both are reflections of the liver. Yes. Keep asking. There's a lot of time for moxa.
I was just wondering if the pain for her was too much underneath, but if she would have been able to tolerate liver 14 palpation.
Well, I don't know. So I didn't. I wasn't pressing for it. So yeah, there's a lot of things that it will be nice to do on people, but if you can't, you can't. Yeah. So it's just like, okay, that was not the. She's clearly a way of we're attempting to treat her without doing too much in the abdomen. Which in a way is kind of, whether it's successful or not, I don't know, but it's in a way, it's a good way to demonstrate that it's possible to treat without even palpating. But at some point you've got to palpate something in order to confirm, or you've got to, unless you're really good with pulses, then you can say, okay, the pulse changed. But how many of you, no offense to you, but how many of us can really do that? Like, wow, the pulse changed. Oh yes, I'm sure. It's like, if you can do that, that's fabulous. Really, that's the best.
What are you checking for on the pulse?
Sorry?
What are you checking for on the first pulse?
Okay, a number of things. The first thing is speed, because we have this thing about rapid and slow. So in rapid pulse, slow pulse is more important in the sense. Slow pulse, we don't do points on the abdomen, and slow pulse type, if you don't find anything in the abdomen, you didn't take the pulse before, take the pulse because chances are they've got a slow pulse. That may explain why you're getting frustrated with their abdomen. Okay.
Because there's no tenderness in you?
Yeah, because slow pulse will not show as much on the front. There are important treatments, the back treatment.
So you palpate and you're not getting.
And you're finding nothing. You're finding nothing. How can this be? You're supposed to have this, you're supposed to have that. And they have nothing. And so what you do is you check the pulse and you go, oh, you have slow pulse. Okay, I understand. And you let go. And you go, okay, now I understand why you don't have it. So first of all is the speed. And now it's very important in cardiac patients. Speed is important, the rate of the pulse. Autoimmune patients, the rate is important. And autonomic nervous system people, the rate of the pulse is important. Those three, I have to take the pulse and know the rate. Secondly, I check for different qualities. And here it's going to get murky because I'm not a pulse expert. So I check for what I call the tight pulse. That's very important for me. Okay. I check for what we call stomach chi pulse. This is these points pulse. It means the pulse goes up and down. It hits you, but if this is the thumb over there, it's not moving from the elbow to the thumb. It's just going good. It doesn't have a slippery quality to it. Okay, that's not going to call stomach chi, no stomach chi pulse. Okay, and the way to get the stomach chi going is through these points, the stomach chi points. Okay, and then the rest is I'm looking for pulses that might be how weak it is. Is it flooding? Does it feel flooding? Especially for cardiac disorders, it's going to be important. Is it weak or is it strong? So the rest, the rest is kind of like whatever I can find, I can find. Pulse. People, in my opinion, have been told pulse wrong. The way it's taught, literally, is wrong. What you should be taught is you should be taught to put your hands on the pulse and wait. And you should be encouraged to wait there for possibly 10 minutes until some quality comes up to you. The problem is we've all been taught, this is wiry, this is slippery, and then you ask another practitioner, they tell you exactly the opposite on the same patient. So then you're getting all confused and then you're getting all flustered because it's like, excuse me, I thought this was this, I thought this was this. It's not important. It's important what it stimulates in your mind. What does it feel like to you? Not what is it supposed to feel like on some exam. Okay? So I think we've all been taught pulses totally wrong, without enough patience to just allow it to speak to you and develop your own resonance with the pulse. That's why when you ask me what do I don't teach pulses. I can't. I have no clue. Now it doesn't mean I don't have some idea what I'm feeling. By the way, I asked Kiiko once, and she said to me, and you won't see Kiiko taking a lot of pulses, by the way, almost never. And also in her clinic, it's true that she doesn't take a lot of pulse. But she says to me, it's not that I can't take pulse. It's just that I can't teach it. It's not that, yes, Nagano could take pulse better than her. Okay, big deal. Okay, Nagano could take pulse better apparently than any human being that we know of. Okay, he was apparently really good at this. So the thing is that she's not, it's one thing to be able to feel things and come up with an idea from a pulse. It's another to be able to systematize it and talk about it as if, that's really meaningful. Okay, and so what Kiiko's saying is that she doesn't, it's not her forte. Doesn't mean anybody can take pulse. Just give them enough time and they'll figure it out. More questions?
Can we ask questions about other things?
You can ask questions about anything. I'm just doing mock-ups. What else?
In cardiac is to determine a root. When weak pulse, I wrote my notes that these are considered spleen 9 and
yes,
pericardium.
because if the pulse is weak, you cannot treat the heart. Two conditions where you can't treat the heart up front. One is if they have edema, because you're pushing the heart against the edema, you're going to backfire. Okay? And the other one, if the pulse is very weak, you've got to have enough substance in the pulse. Also, the heart itself is subservient to the spleen, strangely enough. First comes the spleen. First come the blood vessels. Then, as the organism gets larger, you need a pump. The pump doesn't come first without the blood vessels. Okay? So the heart is in some strange way subservient to the spleen.
And that's when we're using the pericardium points after.
Oops.
Sorry, I'm okay.
Yeah, spleen and pericardium are good friends.
Okay.
Kidney and lung and kidney and heart are good friends. Liver and pericardium are good friends.
So if there's a strong pulse with a cardiac root,
that's a Renfort treatment.
You don't do the pericardium points.
I might have pericardium for other reasons, but
okay,
no.
Okay.
Cardiac with a strong pulse is Renfort.
Can you explain also spleen 3 versus spleen 4?
Yes, spleen 3 we have this idea, okay, it came from Nagano, but Kiiko often will ignore it. Even I will often ignore it. Spleen 3 we use for tiny pulse, when the pulse is small. In chest problems, okay, we have to be careful between the two of them. So, are you okay? I
Yeah.
won't do that point again.
Okay.
Um,
I'm burned really bad, sorry.
Yeah, no, it's okay. Yeah, that's good enough.
Okay, sorry.
It's okay, it's okay. Spleen 4 is the chunk we use when the pulse is strong, when it's flooding. Okay, so there's this expression that when the pulse is big, it's an enlarged heart kind of thing. And heart enlarged, and then you can use spleen 4 because the pulse is big. It's a chunk type situation, but if the pulse is very strong, ischemic heart, not enough blood, you need to use spleen 3 and send more blood to the heart.
Now, is that just on left stern or is it somewhere else?
I only check the pulse on one side, on the left side. I don't check the pulse on the right side. Sorry. I'm not an herbalist, so I don't need all the organs. And I don't have the capacity. I'm looking at the pulse quality as a whole.
Okay.
Does that make sense?
Yeah.
I'd heard somewhere about the amount of time the stomach chi needles get left in being less than.
Could be, doesn't have to be. I don't know. It doesn't know. It's that I would not make that into a dogma. The thing about the stomach chi points is that you can switch them. In other words, if you, like he was asking, I have a bunch of them. Can I do one foot, and so I said, yeah, you can do 1, 2, 3, 4, take out the top after you do the masa and move it forward down. So you basically can have 3 or 4 at a time, no more, but you can actually need up 4 or 5 in a session. Okay. So, are you okay?
Mm-hmm.
This feels okay?
Yeah.
Okay. We'll get you started. All right.